Hi class, this is my PowerPoint presentation on my case study JP, current exacerbation of congestive heart failure with comorbidities of borderline diabetes mellitus type 2 and hypertension. This is for Nursing 442, Nursing Case Management of Vulnerable Populations. My patient JP is a 68-year-old male, Caucasian, married with 4 children. JP and his wife live in their own home and are generally self-sufficient. Although they have 4 children, only one lives locally and the other lives out of state. The one local son does visit frequently with his wife, but works full-time and has 3 children of his own who all have activities and sporting events. Currently, JP was hospitalized for an exacerbation of congestive heart failure with an elevated blood sugar. JP was diagnosed with congestive heart failure in 2015, hypertension in 2002, and is a borderline diabetic managing his blood sugar with diet and exercise. Recently, JP has become severely short of breath with severe edema in his bilateral lower extremities. Onset was fairly sudden and, according to JP, was not precipitated by anything out of the ordinary, although recently he had a bout of influenza A and was unable to eat well, exercise, or manage his medications well, although he does not correlate the two. According to him, he takes his medications as prescribed and monitors his blood sugar as well as his weight and blood pressures. JP is fairly active, walks frequently for exercise, and golfs regularly. Until his recent hospitalization, he was able to perform all activities of daily living and was managing his chronic illness well. Currently, he is unable to walk any distance without feeling short of breath, is suffering from generalized weakness, and he is not able to drive. Although JP's wife is fairly self-sufficient, she does not like to cook, and nor does she drive. She is unable to assist JP in most aspects of his ADLs, as she has health issues of her own. Prior to this hospitalization, the patient was fully ambulatory, able to bathe, dress, feed himself, and perform all normal activities of daily living. In addition, the patient was able to golf and briskly walk 4 to 5 times per week for exercise. The patient was able to drive and get himself to all doctor's appointments and social activities. JP managed his own medications and diet in order to control the symptoms of CHF, hypertension, and his borderline diabetes. As the patient is extremely short of breath and suffering from generalized weakness and bilateral lower extremity edema, he is unable to walk any distance. He cannot perform his ADLs without shortness of breath and needing to rest. Due to the patient's shortness of breath, he is not comfortable driving, and his wife is unable to drive. In addition to his current medication regimen, new medications have been added to his plan to help control both his congestive heart failure and his diabetes. The patient will need to be on a more strict diet for control of fluid retention, as well as blood sugar control. Until he can get back onto his prior self-sufficient capacity, he will need assistance with his ADLs, along with meal preparation and medication management. In addition, the patient will need transportation that he is unable to provide for himself. In the case of JP, the priority planning for his discharge will be to ensure that he will have adequate information provided to him regarding his medications, new and existing. Ensuring that he is informed regarding each medication and its purpose will empower him to be more compliant in order to return to his previous level of self-care. Being that he is unable to drive currently, access to medications could be limited. Ensuring that medications are accessible will be key in his compliance as well. Since JP is currently unable to ambulate any distance and becomes short of breath with minimal activity, assistance will be necessary for him to bathe and dress, along with preparation of meals and other self-care activities. Providing in-home health services to assist JP will prevent the family from having to provide such care. In addition, obtaining durable medical equipment such as a shower seat, bedside commode, and supplemental oxygen if necessary will assist JP in his recovery at home post-hospitalization. Follow-up with JP on his recovery will be important in determining if his needs are being met and if he is having any difficulties with his new medication regimen. Should he need further resources, follow-up assessment will provide a time to make that determination and assess current needs. Symptom improvement, and return to prior level of self-care are the ultimate goal. Being that the patient has a good social support system, including his wife, son, and family, along with friends from the Elks, he will have some access to assistance from them with regards to transportation if needed. Engaging his family in his plan of care and new medication education will help JP in his management. According to Larson, education serves as an essential vehicle to provide the client and family with the knowledge, skills, and confidence needed to address the many facets associated with living with a chronic illness. In addition to medication teachings, teaching about the illness and early warning signs and symptoms of an acute exacerbation will assist the patient and family in what to watch for to prevent further hospitalizations or exacerbations. To promote improved quality of life for the patient, returning home will provide the highest level of comfort and will allow him to return to a more normal environment in which to rest and heal, along with getting into the routine of his new illness management. In the case of JP, the nurse case management patient level strategies that would be appropriate for him would be assessment and planning healthcare at the patient's level, teaching about the disease process, management and treatment, coaching symptom self-management, and empowering this patient. According to Larson, empowerment is important for clients with chronic illness because it increases perceived quality of life and promotes self-esteem. The nurse case management system level strategy that would best benefit this patient is planning and coordinating resource management, such as in-home healthcare and rehabilitation, and team communication. In the case of JP, he has multiple doctors and is treating a duo of chronic health conditions, and adding rehabilitation and home healthcare, there will need to be excellent communication and an intermediary to see to it that each part of the team is kept informed. In teaching the patient and his family about the disease and the disease process, quote, education serves as an essential vehicle to provide the client and family with the knowledge, skills, and confidence needed to address the many facets associated with living with a chronic illness. Larson. Chronic illness not only affects the patient, but the patient's family. Assessing the patient's and the family's readiness for learning is significant in determining and developing a plan of care that is teachable to the audience. Teaching and learning go hand in hand, and in order for someone to learn, they must be ready. Quote, readiness to learn refers to the time when learners are receptive to learning, end quote. For learning to occur, clients and family members must be ready to learn and possess average to high self-efficacy. Larson. Self-efficacy being the belief that one can learn and succeed. In teaching and providing information, a transformation can take place and empower the patient and the family. By offering useful information and key tools, the rate of success of the plan will increase substantially, increasing the overall empowerment of the family and patient. Knowledge is power. Information about all aspects of chronic illness management is essential to restore power and control for persons with chronic illness and their families. Larson. Quote, empowerment is a health-enhancing process, end quote. Self-awareness and self-determination, being able to make choices and accept responsibility for those choices, are important factors in empowerment. One aspect of empowering a patient and family is through health coaching. Empowerment is important for clients with chronic illness because it increases perceived quality of life and promotes self-esteem. With JP being in the position of being unable to perform his IADLs and ADLs, his self-esteem could need a boost. Reinforcing that he has the ability to turn things around will help to further promote JP's healing. For JP's future, coaching symptoms of self-management would allow for JP to recognize when he is beginning to have an exacerbation of symptoms and attempting to control them before they become bad enough to be hospitalized again. Developing patient-centered and family-centered strategies for JP will help to promote his self-management and further empower him to be successful. Some strategies that can be developed include how to incorporate additional lifestyle changes, teaching additional prevention strategies, and teaching him how to make decisions that will help him manage his chronic illness. Quote, persons with chronic illness must be empowered to be managers of their own care within the capabilities and settings, end quote, Larson. Included in self-management would be medication management, dietary considerations, as well as psychological development of JP's ability to deal with chronic illness. Planning and coordinating of resource management and allocation will help to fill in the gaps of JP's care and will ensure that there is no duplication of services, but that the service necessary can be obtained. Some of the services that JP could benefit from would be an in-home healthcare aide to assist him with his ADLs while recovering from his exacerbation. Being that his wife is unable to assist him and she is unable to drive, in-home care would be ideal. An in-home care aide would provide JP and his wife with further education regarding his chronic illness and management of them. Reinforcement of medication regimens as well as assistance will help to build efficacy, self-efficacy, as well as further his empowerment and ability to manage his chronic illness. In addition to care provided in the home, JP will be most benefited by his doctors being familiar with what each of the other's doctor's plan of care is for JP. Arranging for doctor's appointments prior to discharge will help lessen the workload after discharge. Ensuring rehabilitation coverage and setting up appointments, whether in-home or at a facility, will allow for adequate planning for transportation. Home health needs to communicate back to the nurse case manager JP's progress, condition, needs, and concerns in order for them to be met. The nurse case manager can ensure that the communication between physicians is maintained and that the priority needs assessed are being met. With a nurse case manager involved in coordinating resources, evaluation of the plan of care can be monitored and modified as needed. Follow-up of JP and his family will provide necessary resources for questions and concerns as they arise. In addition to seeing the needs of JP, family needs can be addressed as well. Quote, case managers are often the disseminators of the information that the family needs to cope, end quote, Powell and Tahan. Utilization review is the process in which medical review determinations are made based on clinical guidelines and structured processes. Utilization review modalities are established criteria to evaluate medical services for necessity, level of care for appropriateness, quality, and timeliness of discharge, end quote, Powell and Tahan. In the case of JP, he will be able to be discharged home, and utilization review will consist of ensuring that the services he needs were accessed. In addition, ensuring that services are covered as medically necessary, along with making sure that there's minimal duplication in services, will help to control costs. With regards to quality and safety, it is important that JP is discharged at the correct time when his symptoms are well controlled. Providing adequate teaching and information regarding CHF and the causes and preventions of it will help JP to better understand his chronic illness and how to control the symptoms. Quality care will continue post-discharge with home health reporting back to the nurse case manager and the nurse case manager continuing to monitor the patient's condition. The patient will remain hospitalized until his symptoms are under control. JP's home is a one-story and free from clutter, so the use of durable medical equipment safely will not be a problem. Continued teaching regarding medication management will ensure JP can safely manage on his own. Including the family and teaching will allow for him to ask them questions should they have any. At the patient level, effectiveness will be monitored. Prior to discharge, JP will be able to communicate the plan of care and goals of care. In addition, he will be able to teach back what his medications are, what they're for, and how to properly take them. A calendar of appointments will be a useful tool with the appointment and the arranged transportation listed. Along with the appointment date and time, who the appointment is with and what it is for will be included. Additional effectiveness will be monitored post-discharge with follow-up on his condition. Improvement of symptoms and return to full functionality are the goal and will be assessed on an ongoing basis. Effectiveness at the system level will be adequate home health services arranged in which a home health aide will assist JP as needed with his ADLs until he can do so independently. Having durable equipment ordered and delivered prior to discharge will be necessary in order to ensure a safe transition home. Appointments for physical therapy in or out of the home will be arranged and placed in the calendar as well. Clear, consistent communication with JP's doctors, his primary care physician, along with his cardiologist, regarding the plan of care will be kept up, and each doctor will be aware of the other's plan and of JP's progress. References.